Rhinoplasty is the hardest thing we do because it's a three-dimensional structure. It's in the midline, so everybody's looking at it, and it's a fourth dimension because it changes over time. But rhinoplasties, because they're so hard and challenging, are the most fun, I think. Here's a picture of a gal. Here she is before, there she is after. Can't tell a lot of difference, can you? All right. What's the difference?
No more ski lift.
No more ski lift, that's right. Anything else?
The chin.
Pardon me?
The chin.
Bingo. That's right. So what we do with every rhinoplasty patient come in is we do a facial analysis and the proportions, and it turns out there are certain proportions that follow along the golden rule or Farkas's law, and it's the rule of 2/3. So this distance ought to be 2/3 of this distance, and this distance ought to be 2/3 of that. And so her nose was too projecting, had too much shape in there. So we weakened her projection, and that's all we did. We didn't touch anything, and that made that much prettier shape. And then her chin was too far back. So we put a chin implant in through that same incision you do a myeloplasty on, and look how much better her facial balance is. That's a normal lady you see at, Harris Teeter. That's a really pretty lady, and the only difference is her nose. Oh, maybe your picture will be in here later. Okay, here's one of the younger patients I've operated on. I think she was about 14, and normally we don't operate on 14-year-olds, mostly because their mental state's not good enough to be mature. And they have to have begun their period, so their nose is pretty much full grown. But she's got this cleft right here, and you'll see from the side shot, it really wasn't very good. And she had no support in the tip of her nose. So here she is afterwards from the front. And there she is from the side. That looks like a little old lady's nose. It doesn't look like a 14-year-old's nose, but that looks like a 14-year-old's nose. So we put cartilage support in here, giving that tip support. We didn't do anything to that and changed it from a convex nose to a concave nose. And that changed her outlook 100%. She was a wallflower, and then she was on the debate team and a cheerleader and incredibly outgoing. And I actually have her, like 1 year later picture she sent me in her cowgirl outfit. And I tried to get on this slideshow. I just couldn't get a glare-free picture, but it was really transformational. Not a bad nose, but not very feminine nose. Much more feminine nose. Just like eyebrows are a little higher feminine, a concave nose is a more feminine feature, which is great for the ladies, but you got to stay away from that on the men. Convex nose, facial analysis shows that chin is too far back. Change the nose, add a chin implant, much better balance. Convex nose, a little bit concave nose, more feminine, isn't it? But they still look like the same people. Big nose, straight nose. You get to pick straight or concave. You do this through a little incision between the nostrils called the columella. There's a good word for you in Scrabble. Columella, and then connected inside incision so that it's just a teeny little incision here that heals fantastic. Lift the skin up off the cartilage and bone, change those tent poles around, put the skin back down. Normal nose, a little more feminine nose. Male, didn't like his bump, wants it straight.
Wow, that's great.
Questions about rhinoplasty? Chin implant we've sort of talked about. Show you a few more. See how our face is sort of rounded? Because a line drawn from midway through the nose through the upper lip on a woman ought to be within 2 millimeters of the chin, and on a male probably right on the chin. And she's very round. Here she is farther forward. Better dimensions, isn't it?
Yeah.
Same with this. This guy wore a mustache his whole life because he didn't like this and he thought his chin was receding. I'm not sure why that worked for him, but he felt like it did. So he gets a chin come out. We deepen this area with a myeloplasty. So the chin implant goes in through the same myeloplasty incision, and now he's confident enough to get rid of the mustache. And that's what this whole thing is about, is confidence and how you feel about yourself and then how you act on that. And things don't have to be perfect. They're never perfect, but they're safe and reliably and predictably better.